Tonight, advances in medical technology and procedures are nothing short of amazing, especially in the operating room. Our first story is about how one local hospital is using that technology to educate the public about heart surgery.
90-year-old George Growen is a hometown hero in Reedley, California. He is considered the father of the Reedley Spectacular, the largest custom-made 4th of July fireworks show George has orchestrated since 1951.
We get ready for the show. It takes us about 4 months to make up what we're going to do. And our show lasts about an hour and 10 minutes. And we get quite a few people there.
But last year, heart surgery threatened to keep George from his lifetime passion of making fireworks. George had his surgery at the Fresno Heart Surgical Hospital, a place he described as one he didn't want to leave.
I describe the Heart Hospital as basically a hotel where they provide medical care. I mean, it is very nice for the public. The rooms are private. They're very large. The families don't feel cramped when they're in the rooms.
Are you hungry?
When I woke up, I looked around. I seen they had gone through the operation, and it went well, and I was in the room, and people in there talking to me, and I felt good. I started recognizing if my family was there, and I felt good about that, and then I finally made it.
We make a great effort on trying to provide the comforts and services that people would expect from any facility where they would stay overnight, whether that's a hotel or a hospital. Underneath all of that, however, is a framework of diligent care by the nursing staff, by the physicians, by the administration, to make sure that we continue to push the envelope to provide the highest quality of care that we can.
Part of that high-quality service is the community education provided by the Fresno Heart Surgical Hospital. Dr. Richard Gregory performed George's surgery in front of a live audience. Using this live from the operating room technology enables clinical professionals, patients, and families to watch a live surgery.
If you have a question for the surgeon, you can also raise your hand, and then when there's a gap in the case, I will ask him the question. But for the most part, he will explain each step as he goes along.
So we've had very good response from the public. They've enjoyed it very much. And actually the patients have been part of our biggest joy out of this because they really want to be involved. They want people to learn from their experiences.
Dr. Gregory worked with Dr. Sundrani, a cardiologist, and Dr. Stern, a vascular surgeon, to address George's coronary disease and aortic valve disease, which caused blockages near the heart, and peripheral vascular disease, which contributed in narrowing of arteries in the neck and brain.
When people come in with coronary artery disease or hardening of the arteries of the heart, it's very common that we will see that they have the same disease either in the arteries to the brain, in the carotid areas, or even down in their abdomen and in their legs. The same disease process affects all of the areas.
Narrowing of the arteries is most commonly caused by smoking, diabetes, or a family history of coronary or vascular disease. George's first symptom was severe back pain.
Go ahead and charge again. Charge. There you are.
George's surgery took 4 to 5 hours, followed by a week recovery period in the hospital. Dr. Gregory said this is typical.
Our goal is to get him healed up as quickly as possible and hopefully back to the productive life that he wants to lead.
Dr. Gregory said the most discomfort is felt in the first month at home. After 3 months, when the patient has surgically healed, energy increases, normal appetite and sleeping patterns return, and the patient begins to feel much better. Now George is back to all his favorite activities.
I can do anything and everything. The doctor told me that go ahead and do what you want to do, drive and all that. So I drive to Fresno to my nephews, and I have lunch with them every Sunday.
Hey, George, remember this?
And, of course, preparing for the next Reedley Spectacular on the 4th of July.
He said he wants to live to be 100. Good for him. I think he'll make it.
George, you're the bomb. We wish you many more explosive years to come. If you would like more information about Live from the OR technology or watch a live heart surgery, you can call the Fresno Heart Surgical Hospital at 559-433-8014 or log on to our website at medwatchtoday.com.